You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Thank you so much for joining me here today on this Total Wellness Tuesday show, where we are going to be going over the very important topic of early warning signs not to ignore because of potential imminent heart issues. This is one of these topics that, of course, you want to know for yourself, but really make sure that you're able to share with parents or coworkers or friends or family. And the reason is this: a lot of people talk about their current health issues, what they might be suffering from, or even something that's just started to come on. It's at that point, it's when they're sharing those symptoms or you see these symptoms in yourself, you might have just shrugged them off recently, is that you look at these as real potential issues for the number one cause of death right now in the world, and that is heart disease. So it's so important we look at this. I'm going to go through the exact numbers. There's actually 12 of them, I believe, that we're going to go through today. I should say 11. And once we go through all of those, you're going to have a much better sign for all of the early warning signs that really, like I've always said before, these things such as heart attacks and stroke and cancer and all these things, they don't typically just show up overnight. They don't. There's usually these early warning signs that the body is out of balance. And if we begin to recognize and even just look for in the first place, because again, most of us have never been taught, but if we are taught and then we're able to see those warning signs, we can get to the doctor, we can get the medical exams run, we can know what to look for. And then, of course, even if, give us the diagnosis, well, then let's work backwards. Let's start to clean out those arteries because it can be done. So let's talk about those things today. So I just mentioned it, but heart disease really it's the number one right now. I know that in the future, it may be surpassed by other health conditions, but no matter what, it's going to stay in the top three. And here's the thing, and it's because heart disease and coronary artery disease are the main causes for heart attack. So what happens is you essentially have these arteries, and it's something called atherosclerosis, and we get this hardening of the arteries. So what happens is cholesterol and plaque begin to develop in the arteries as well as inflammation. I don't think that we can discount that. It's one of the reasons why I really talk about so much about the importance of knowing your omega-6s to your omega-3s. And the reason I say that over and over is because 50% of the people who have a heart attack have normal cholesterol. And of the other 50% obviously have high cholesterol. Well, even for people with a low cholesterol, why is it that they can still have a heart attack? And the reason is they can still have hardening of the arteries and they can still have constriction. Arterial constriction is called. So just the arteries being shrunk or squeezed. And that happens with inflammation because they're not allowed to expand. And when they can't expand, it does not allow the blood to flow through naturally. And then, of course, we can have the lack of oxygen being delivered to the heart. When that happens, the reduced blood supply then can lead to the coronary heart disease, and it can lead to, of course, a heart attack, whether that be fatal or not, or potentially just decaying or dying of that heart tissue. So then people have really reduced stamina and reduced quality of life. Really what I want for you is to understand that as we go through all of these topics with the Cabral Concept, you might be 25, 35 years old listening to this and be like, oh, I'm not going to have a heart attack. Here's the thing. Your arteries are starting today or 10 years ago or 20 years ago. We're finding this in 8 and 10 and 12-year-old kids. It's unbelievable. Already with plaque in their arteries, already with cholesterol building up in their arteries. So we have to look at this as this is not an older in life-based disease. And again, I say that as disease. There's no such thing as forget about, yes, of course, there's genetic predisposition, but throw that out the window in terms that you can do nothing about it because that's simply not true. And I don't care if you've ran your genetics and you're an ApoE genotype 4-4 or even a 3-4, trust me, you can do a lot about that. And that's why your genetics really should take a back seat to your overall lifestyle. Because if you are living in balance with yourself, with your life, with inflammation and with good food and omega-6s to omega-3s, then you are not going to have to suffer and deal with a lot of these things that right now, 1 out of 2, 1 out of 3 people are having to deal with, which are coronary artery disease or just heart disease in general. So let's go through some of those signs right now. This is so important because remember, They're all signs that someone could be having a heart attack right then or within days or hours or anything like that. But it's also signs. These are also signs that heart disease might be in your future, meaning like coming within the next couple of years. And that's because it's a change in your homeostasis. I always talk about that. Homeostasis and equilibrium mean keeping the body balanced, right? And the body can stay balanced until you've essentially filled up that rain barrel. And once you've filled up the rain barrel with toxins and stress and lack of sleep and poor food and weak digestion and medications and all of those things, once you've filled that up, okay, at that point, the body has a much more difficult time staying at a state of equilibrium or homeostasis. And that's just balance. Because remember, every second of the day, your body's on that teeter-totter going back and forth, positive and negative feedback loops, trying to keep the body balanced, okay? And it does that by robbing certain areas of the body to make sure the blood has enough, whether it's calcium or magnesium, potassium, sodium, any of those things are all regulated in order to keep your body balanced. But at some point, your body can no longer keep up with the demands because of whether it's a high stress lifestyle or nutritional deficiencies, or it's just been over time, right? It's been years and decades worth of buildup from poor food, maybe when you were younger, any of those things. And again, now they've kind of come to a head. So let's get started with symptoms. And I really want you to kind of make note of these and hopefully be able to share this show with a parent. You know, even if they only listen to one Cabral concept, maybe this is that show. Maybe this is the show that they should pay attention to, especially, again, how many people do you know that are on statins or on blood pressure medication? And you have to understand that those medications also weaken the heart. Yes, they don't allow for as much cholesterol to be even produced by the body and certainly not absorbed in the arteries, but that's not necessarily a good thing in terms of hormones and certainly not a good thing in terms of the heart actually becoming weaker whenever you're put on a statin. So just something to look at, meaning that there's always a cause and effect in the body. Okay, you take this medication, you create less cholesterol. Okay, well, now you're going to create less testosterone. You're going to create less DHEA. You're going to create less hormone in general. On the flip side of that is that your heart's actually becoming weaker. And that just for one easy, I mean, there's many, many reasons, but one easy reason is this, is that your body could no longer convert or can no longer actually make that full conversion of coenzyme Q10 to ubiquinol. And why that matters is that, at least for your heart, it's one of the most important nutrients that you can get in terms of ATP and energy. So important. Again, I know there's a lot of people supplementing with ubiquinol, which is great. And I'll link that up. Why don't I link it up in the show notes today? Usually, I don't always put those things in, but episode 816. So StephenCabral.com/816. I will put in, why don't I put in the signs? I'll do that. Just like a really quick checklist. And then I will also put in well, actually, I don't know if I'll put in on the signs because I like people to have the details behind it, but I will put in the ubiquinol there. All right. So again, feel free to share this with whoever you believe it will help. And let's get right into the show. So the first one is the one that most people know about. So I always like to get that just out of the way. So chest pain, a lot of people know about that, right? And the pain down their left arm when they're having a heart attack. But again, you can have that days and weeks in advance. And you might only feel it for like a couple minutes to 10 minutes, 20 minutes, and then it goes away and say, okay, I don't know what that was. Maybe it was indigestion or something like that. And that's possible, right? That's possible. We'll be talking about that in a moment. But in general, if you're starting to feel a little bit more chest tightness, like a little heaviness on your chest, almost like someone's kind of like sitting on it, that is a first sign. That is your first sign that there might be some lack of oxygen, that there might be some arterial constriction, that there might be some hardening of the arteries. Let's pay attention to that. I think that's extremely, extremely important because that is kind of your number one sign. But there are many more, so let's go over that. The next one is this, an irregular heart rate. Now, we're not just talking about arrhythmia. So yeah, if you've been diagnosed with arrhythmia, I understand that, a little bit of an irregular heart rate. And again, a lot of those can be corrected because there's actual mineral imbalance. There's a mineral imbalance sometimes between calcium and magnesium, and sometimes in terms of sodium potassium. The typical one is an imbalance between calcium and magnesium. So that's important to look at. It's important to get checked out. And of course, you can run a hair tissue mineral analysis for a real analysis of your calcium magnesium levels. Now, again, irregular heart rate could be just nervousness, could be stress, but keep in mind that nervousness on a daily basis, that anxiety and that stress can lead to the increase in those fight or flight based hormones, which could increase inflammation, which could lead to more heart disease. So let's not discount that either way, but keep in mind, irregular heart rate, if it's recent, if it's come on, you should definitely get that checked out. Okay, the number 3 is nausea. So what about nausea? Meaning like feeling like you're going to have to vomit or you're going to throw up. Well, now again, Could this just be because you ate something that didn't agree with you? But no, if you're feeling nauseous over a period of days or maybe even weeks, we want to look at the gut. Of course, we want to look at what's going on there. Did you get food poisoning? Did you get C. diff? Did you get H. pylori? Any of those things that you can have in your stomach. Absolutely. There is that, right? There is that. There's also anxiety that can cause some nausea. But nausea as well is one of those signs that a lot of people don't know about that can go along with heart-based conditions. Let's keep that in mind as well. All right, number 4 is heartburn. Heartburn is a big one. A lot of people mistake acid reflux. They mistake it as acid reflux when really it's a heart-based issue, right? And potentially an imminent heart attack. So keep that in mind. If someone who doesn't typically have heartburn all of a sudden says that they feel like they're having heartburn, if that's accompanied by any of these other ones, that is a reason to get that checked out immediately. All right, number 5 is dizziness or lightheadedness. A lot of times, again, I always like to make the correlation. So we have the dizziness and we have the lightheadedness. And what I want to do is I want to put this into context as well, is that if this is a recent, like you just start to feel a little bit more lightheaded, a little bit more dizzy, and this is new for you, okay? Why am I feeling dizzy? There are many reasons, and I've answered them many times on the Cabral house calls, not in terms of heart disease, but other issues. So go to stephencabral.com/podcasts and simply type in dizzy or type in lightheaded, and you'll find all of my previous podcast answers on that because there are many. There's actually a sodium depletion. So when you get depleted of electrolytes, namely sodium, you can start to be lightheaded. When you're going through adrenal fatigue, not the adrenal alarm stage or really resistance stage, but once you're in more of the burnout, what's going to happen there is that the hormone aldosterone is no longer being produced as it was previously when you were in fight or flight, when you were in more of the alarm stage, and even the resistance stage, because aldosterone gets produced at a higher level to work on arterial constriction, again, potentially causing those heart issues. And then what happens over time is that hormone can no longer keep up. So that's the last stage where you have low cortisol and you have low aldosterone. Believe me, I know what that's like. I used to be on medication for that. So again, when they diagnosed me with Addison's disease, I wasn't producing any aldosterone either. And so that led to really, really low blood pressure. So they actually put me on reverse blood pressure medication. It was actually medication to increase blood pressure. And the other medication I was on was Cortef, and that was to increase cortisol levels. But again, when I started to do the research, when I looked in the research and I realized I'm a young guy when I was put on these medications. And if I was going to be on them for 20, 30 years, really good chance I might die at a young age because of all of this medication that I'm being put on. So again, I made the decision at that point that was not going to be my life. Very, very happy, of course, that I made that decision and that I no longer have Addison's disease. All right, we are about to get started with number 6. So essentially the last half of our 11 signs of an imminent heart-based issue. But what I want to let you know is that I apologize about the first half of this show. I'm actually re-recording. So this is a re-recording of the second half because the audio quality was not where I wanted to be. And I want to make sure that whenever you're listening to the Cabral concept, that it is good quality audio, that you have a good listening experience. And so I apologize about that. My podcast editor actually let me know, and so this is a last-minute second half recording. What happened was there was a loose connection with the microphone. I apologize about that, and we're going to make sure that we keep that audio quality up there. So let's get right back into the show. Number 6 is any type of throat or jaw pain. So this is something that I found very, very interesting. There was actually two overall with this show. Is that when I was looking into all the different signs for imminent-based health issues in terms of the heart, most of us, when we go through our training and schooling, we're looking at, okay, these are all signs of someone having a heart attack or signs of someone with a heart-based condition. But not often is it mentioned throat or jaw pain. So that was one of the two. The very last one is the second one that I will get to. So I love learning new things. I love learning about new research, and this was a fun one for me to see. And of course, not fun in terms of what it can cause, but you have to know that. You have to have the knowledge. So that's why I always say, although I did get sick and obviously it took me a long time to recover, I learned so much along the way. And that's why I'm recommending to you right now, no matter where you're at right now in terms of your health, the more you learn, the more you'll be aware. The more you're aware, the more steps you can begin to take to make sure that your health doesn't start to slide. I say that all the time. If I ever feel like, a little less energy or some brain fog, whatever it is, I look at what am I doing differently? Like what's different over the past couple days or weeks that I've started to slide, and then I can just get right back on track. Very, very important to always have that roadmap. So throat or jaw pain. And again, I'm not talking about if you have swollen glands because maybe you got a virus or an illness, but this is throat or jaw pain that's been going on now for, let's say, a couple days to a couple weeks, or it comes on sharply. And again, we know that this can do with dental-based work, and maybe there's something wrong in the mouth specifically, or in the sinus cavity leading down to some throat or jaw pain. But I want to make sure that if this is an issue right now, and a lot of these things can relate back to some type of acid reflux. So it's not funny. I keep saying it's funny, but it's funny in the terms of that a lot of these things that can mimic heart-based issues can also be stomach acid related, indigestion related. And that the two are connected. They really are, because if you're having stomach-based issues, digestive-based issues, we can see that in the body, so many other things tend to go wrong. And that can be poor breakdown of food, poor digestion of calcium, magnesium, zinc, vitamin B12. All these things can calm the sympathetic nervous system. So really, really important to look at that. But throat and jaw pain, I want to make sure that if you, again, any of your loved ones have some of those symptoms, along with the dizziness, the lightheadedness, nausea, chest pain, make sure that they're seeking out help. All right, number 7 is starting to feel tired more easily. So this is a big one. Everyone that I've worked with from a cardiac rehabilitation standpoint, meaning that they've already either gone through angioplasty, they've gone through coronary artery bypass surgery, or they have heart-based condition, right? They have some type of coronary artery disease, is that they're eventually starting to feel more tired, more weak, more fatigued. And that obviously, this is almost like straightforward. If you're getting less oxygen to your tissues and even less oxygen to your brain, you're going to start to feel more tired. Your recollection, your recall, all of those things will start to go down. This is very important to look at because this is one more sign, and it precedes, remember, this typically precedes any heart attacks or strokes or any of these conditions, because the body doesn't happen all at once. You start to see these things fall into place, and fatigue, being more tired, really important that we look at that as well. All right, number 8, this is huge, sweating more easily. Have you found yourself, or do you see someone that you know that you care about starting to sweat a little bit more easily? And again, I say this all the time. When I'm meeting with someone in my practice, they're either on Skype and I'm looking them over video, or they're in my office. Essentially, it's the same thing. If they're sweating, I can tell. I can tell someone that they're just a heat build up and they're starting to profusely sweat, or just sweat in general, maybe just a little sweat above the lip. And I say to them, and I say again, like, I don't want to make you self-conscious. That's not my intent here. Most other people would never notice this, but I've noticed that it looks like you're perspiring. Again, we're just having a normal conversation. I don't think it's nerves. I don't think it's anxiety, anything like that. Although it can be, again, anxiety can lead to the sympathetic nervous system dominance, which then can lead to sweating, but that can also then eventually lead to heart-based conditions. So again, they're all interrelated. But this is something that's extremely important as well, because a lot of times when we're starting to produce more adrenaline or norepinephrine, or we're in that fight or flight, we are starting to constrict the arteries. We are potentially creating more inflammation in the long run, and that leads to that arterial-based constriction. But sweating profusely or sweating more easily, that can go along with as well having some type of coronary artery disease. And the reason is that your body has to work like much, much harder, a lot harder, to be able to get blood flow to the extremities in the body. All right, so that's very, very important. And again, like, I see these things transform all the time. People in my practice, 12 weeks later, 16 weeks later, working with my health coaches, working with myself. And what happens is we've looked at their cortisol levels and we have helped them calm that. We looked at a hair tissue mineral analysis and we saw the high electrolyte, the high fight or flight, and we've helped to calm that as well. So when we do those things, then again, they start to, it's not that you don't sweat anymore. You're supposed to sweat. That's actually very normal and very healthy, but not when just sitting down, and certainly not when just doing normal everyday activities. So we look at that and we're able to obviously then make the correlation with symptoms, which is the sweat, with the underlying root causes, which a lot of times might be some of the HPA axis dysfunction, which is the cortisol and adrenaline-based pushing of that sympathetic nervous system. So, but really good to look at in terms of imminent heart-based issues as well. And when I say imminent, I'm talking about days, weeks, months, or maybe in the next year or so. That's all what we look at. Again, how slow the progression can be or how quick it can be as well. All right, number 9 is starting to snore. So this isn't someone that's been snoring since they're 8 years old, 10 years old, 15 years old, however old it is. But it's like, okay, it's happened within the last couple of weeks or months. And this could be a more difficult ability to get oxygen into the body. So now some of it can be this, like, I don't want it to say that like this automatically means heart condition, but let's say you have a sinus infection or, allergies. You might have a more difficult time breathing through your nose right now at night. And so what happens then is that you might turn into more of a mouth-based breather and your tongue can fall back. You can have apneas or you can just be snoring during the night, even if you're lying on your side. So it's important to look at it. I'm not saying that if you snore automatically it's heart-based issues, but there is some correlation with sleep apnea or apneas and having some heart-based issues or potential heart issues in the future. So I don't want to undermine that, and I don't want to say that that can't be an issue, especially if you have a few of these other 11 that we're talking about here today. So I want you to keep that in mind. That's one more to look at. All right, number 10 is swollen legs and ankles. Really, really important, because here's the deal, that when someone's starting to have heart-based issues, their heart is not keeping up with the demand, it makes it harder for the kidneys to remove excess water and sodium from the body. And when that happens, it actually leads to what we would call like bloating of the legs. So the legs and ankles start to get more swollen. And one more big point to this as well is it much more difficult for the heart to pump fast enough or hard enough to push the blood back up from the veins, get it moving up from the ankles and from the feet. So that is a sure sign of kidney-based issues, heart-based issues, and potentially even blood pressure-based issues. If you see your ankles getting a little puffier, a little bit more swollen, again, it can be other things as well, but I want to make sure you get that checked out because it can be heart-based issues. So important to look at that. I'm sure you've seen the exaggerated cases where the ankles get so swollen it almost over a person's shoes or over their sneakers. But that is a later term. I'm talking about swelling of the ankles, a little bit more puffy down there. Really important to look at because, again, that can be congestive heart-based failure, and I want you to pay attention to that. Again, coworkers, loved ones, anyone that you see, just make sure you're keeping an eye out. We really do. We have to help each other out, and you can do it in a nice way. You can say that, hey, I was listening to this podcast. Check it out. I just think that it might be helpful for you. All right, number 11 is this. So a persistent cough that will not go away. And this, I'm telling you, this was the second one that I said, that makes total sense, but it's not something that we always talk about in the medical-based literature. We always talk about the chest pain going down the left arm or the tightness in the chest or anything like that. But what about a cough that won't go away? This is extremely, extremely interesting. And that's because when I was looking through the research, I saw this, is that the body producing this kind of long-lasting mucus, especially, we talk about it sometimes as like a pink mucus. Well, that can actually be from a little bit of blood. So that's not ideal, of course. If you ever see yourself coughing up a little bit of pink mucus, that is specifically typically mucus production with a little bit of blood in that. But what happens is the heart can't keep up with the demands. And with that mucus, the lungs are sometimes leaking, or I should say the blood's leaking back in the lungs, which we certainly do not want. So here's what I want to go over on this. I was actually sitting beside a gentleman just coming back from LA, and he was 2 seats over from me. His wife was in the middle. I was on the end near the window, and he had a persistent cough the whole time. When I was looking at that, and I was looking at, obviously, the research I had just done, it was all dawning on me because I've been doing this for a little while, and I've looked at all the signs and symptoms, and when I see people, of course, I'm not judging. I do my best, right? I do my best. But what I'm looking at is I'm always reading people. I'm always looking at all these signs and signals. I can't help it. I read everyone's dosha. Right as I see them, I know it's the endomorph, the ectomorph, and the mesomorph. And in Ayurvedic, it's the kapha, and it's the pitta, and it's the vata. And when I saw this man, he's an endomorphic body type, and he was overweight. He was probably 60, 70 pounds overweight. He was in his late 60s to early 70s, I surmised. And so he kind of had the more swollen nose, bulbous nose. He had thicker neck, and he obviously had a bigger waist. He had this persistent cough. He had kind of it's called the clubbing of the fingers, thicker fingers. That's actually one more. That's, I guess, a bonus one is the thickening of the fingers towards the fingernails. So we'll put that in as a bonus one. And so I saw this man, and I could see all the signs of congestive heart failure. I have no doubt, I'm sure he was on blood pressure medication, probably on a statin by this point as well. This did not look like a new thing, and I didn't feel it was my place to be giving him medical-based advice unsolicited. I never feel that's my place. I just don't. I'm always happy when someone asks me a question to answer their questions, but I didn't feel it was my position, especially since what he was eating was, he had Coca-Cola, he was eating cookies, he was eating crackers, and again, not my place to judge either. Like, that's his decision. But the truth is, most likely he was never taught. He was most likely never taught that this food was actually affecting his health. I can almost guarantee you. I know that he wasn't doing it maliciously, and I'm sure that he doesn't want to miss out on some of his prime years. I really believe that. I'm a big believer. I'm a firm believer that if you're in your late 60s, early 70s right now, you still have a good 2 decades plus. You really do. I'm a firm believer in that. I really, really, truly believe that most people now, not only the natural health that we know about, but also the advances in medical technology over the next 10 years, 20 years. I believe that people in their late 60s, early 70s right now will have another 20 to 30 years of living. I truly believe that. And so what I'm saying to you is this. If you know in your late 60s, early 70s that you have another 25% of your life to go, another quarter of your life, here's what I want you to think about. This goes for all of us. I mean, all of us, is that I want you to live out that extra quarter of your life with good health, harmony in body and mind, and not have to suffer. I don't want you to huff and puff every time that you kind of go up the stairs. I don't want you to have the joint pain, the brain fog. I want you to be able to play basketball with your kids, your grandkids, I should say. Like, that should be, maybe not sprinting up and down the court, but you should be able to be out there and be active. I just see that as a great long-term goal for all of us to strive towards. I just don't think that we need to spend the last 25 years of our life, and for a lot of people from 50 years old on, right? And a lot of people in their 40s. So the last, 40, 50 years of your life, you're in pain. You're always going to specialist after specialist, doctor after doctor, swallowing handfuls of medication and pharmaceutical drugs because the first drug that you took led to this, and the next drug you have to take this. And so that's just not what I believe that is best for people and is what's in their best interest. I think that we need to start really looking towards taking back control of our own health. And that starts with either running some functional medicine lab tests, looking at your inflammation levels, looking at your hormones, starting to eat good food, starting to go to the gym or just exercise at home, and especially go for your 10,000 steps of walking per day. It's doing all of these things that are going to give us back our health. And will it happen overnight? No. But that's not to discourage you. That's to encourage you that when you don't see signs tomorrow that you are completely better, you understand that it's not supposed to work that way. That you understand that this is a journey that we're all on, and that if you begin to get results over time, then you will then own those because they will not go away over time either. That if you slowly accumulate those results for your body over 2 months, 3 months, 4 months, that you will see the results and they will be permanent. They will be permanent because you will begin to live a healthier and happier life. That's what I want for you. I hope that you share this message with the world because it's not my message, it's all of our message. And again, thank you once again for tuning into the Cabral Concept. I apologize about the technical difficulties in the beginning. Thank you so much for your support. I truly appreciate you. Take care. Have an amazing day. I want to sincerely thank you for your support of this podcast. I couldn't do it without you, and I mean that. I truly do. I also want to make sure you knew that we now have multiple ways for you to find your answers to the most difficult health, wellness, weight loss, and anti-aging questions. You can find podcast-specific topics like thyroid, adrenal, hormones, sleep, digestion, Ayurveda, and many more at stevencabral.com/podcasts that will then link you to your favorite Apple, Spotify, and other podcast players. Plus, all new podcasts and weekly exclusive video content is being added to our YouTube channel at youtube.com/Stephen Cabral. And that's Stephen with a PH. Head on over and subscribe so that you don't miss any of the exclusive content. Lastly, if you've ever found any of my podcasts or books to be helpful, I would really appreciate it if you could leave a review on iTunes or your favorite media player for the podcast. Rating and subscribing to the YouTube and podcast allow me to reach more and more people and help spread my mission of healing throughout the world. Thank you again for being a part of this movement.